Thank you, Dr. Gersh. I'm going to switch gears a little bit on you now, and let's dive into women's heart health because, as I understand it, women, quote unquote, they heart attack differently than men. And that is because of estradiol. Can you explain that to us, how that works?
Sure. Well, when you look at the whole cardiovascular system, it's so dependent on estradiol for its vital health and structure and function. So if we start with just a very brief overview, the arteries. Okay, so arteries are the lifelines of carrying nutrients and oxygen to all the tissues of the body, including to the heart itself. Those are called the coronary arteries. Now, in order to have healthy arteries, you need to have healthy amounts of estradiol. Estradiol actually activates and maintains the proper functioning of an enzyme called endothelial nitric oxide synthase. And this enzyme helps to produce nitric oxide, which is a gas that is vitally important for maintaining the health of the artery lining, vasodilation, so you don't have constricted, like with hypertension, you don't have your artery going into a tight constricted state, and maintaining and the platelets so they don't aggregate, they don't clump, and you have abnormal, unwanted blood clotting for no particular reason. So you need to have estradiol for the production of nitric oxide. In addition, for like cholesterol, everybody knows cholesterol, it's like so talked about so much. Well, the same enzyme that is impacted by the statin drugs like Lipitor and Crestor, these drugs that are known as cholesterol lowering drugs, that enzyme is actually modulated or regulated by estradiol. So when you don't have estradiol, and of course the opposite when you do, then everything is like good. But when you don't have estradiol, then that enzyme system is not working properly, and then you make too much cholesterol. 90% of cholesterol circulating the body is produced in the liver. So you almost all women after menopause, especially if they're not on adequate estradiol therapy, they will have high cholesterol. So their liver is going to make too much. Their arteries are going to start to constrict. They also, the immune system of the body is, all the immune cells of the body have estrogen receptors. And when you don't have enough estradiol present, the immune cells, just like in the bone with the osteoclast, they go into a pro-inflammatory state, and that is not good. So you have more inflammation, which underlies a lot of the cardiovascular problems, including oxidation, or you might say rancidness of cholesterol, called oxidized LDL or oxidized cholesterol. So without estrogen, you're going to have more oxidation of cholesterol. And there's an enzyme, peroxidase 1, also known as PON or PON1, that is modulated by estradiol. And that particular enzyme helps to prevent oxidation of cholesterol. Now, it's oxidized cholesterol that ends up in artery walls, creating plaque. Okay, so everybody knows of the famous plaque. So requires two things to form. One, you have to have damage of the artery wall, the inside lining called the intima. When you don't have enough nitric oxide, you're going to have damage to the artery wall. And when you don't have enough estrogen, you're going to have oxidized cholesterol, and you're going to be making too much from your liver. So it's like double whammy. Now, when you have oxidized cholesterol, the receptors on the liver called LDL receptors do not recognize oxidized cholesterol and pull it out of the blood to then get rid of it through I call it the trash chute, the bile duct into the intestinal tract, where you can then poop it out. Okay. So, but you got to be able to pull it out of the bloodstream through these LDL receptors. Well, the LDL receptors are modulated by estradiol too. So the cholesterol that isn't oxidized, it's hard to pull it out of the bloodstream. And when it is oxidized, it doesn't get recognized by the receptors and it can't get pulled out. So the special macrophages, the gobblers, just like in the bone, the gobblers, the macrophages gobble up the oxidized cholesterol because it's damaged goods. And that's what they do. They gobble up dead cells. That's how we get rid of our old, dead, yucky cells. Well, they recognize oxidized cholesterol going around in their little envelopes carried around in the blood called apolipoproteins. So they gobble it up, and then these macrophages are attracted to damaged tissue. That's why they pick it up. And now they are attracted to the damaged lining of the artery. So they line up along the inside of the walls. And then when you have cracks and fissures, they work their way in. And then they get stuck inside the artery wall where they then attract more damage. They create more damage, attract more of these macrophages. And then you get basically like a garbage dump in your artery wall. Well, all of that is happening because you don't have enough estradiol. Now, none of that is good for boding well for the health of our cardiovascular system. Now, on top of that, what's called the autonomic nervous system. You see, this is not simple stuff. The autonomic nervous system controls all the things in the body that we don't think about, which is almost everything, like normally breathing, our pulse, whether we're sweating, our tear ducts, gut motility, like just like everything, our temperature, all those things. Well, it controls our arteries, whether they're constricting or relaxing, and also, like I said, our heartbeat. So after menopause, many women will have palpitations, and the incidence of like atrial fibrillation goes way up in women after menopause. And a lot of women are put on beta blockers because that slows the activation of the sympathetic. So the autonomic nervous system, like so many things in the body, it has like the yin yang. So the baseline, the normal state is called parasympathetic, controlled by the vagus nerve. And it keeps everything calm. They call it rest and digest. Your digestion is well. Our arteries are relaxed. Our heart rate is normal. It's not too fast. We're not sweating. Everything is like right with the world. But after menopause, women don't have enough what we call vagal tone, and they become more sympathetic overdrive. Now, sympathetic, think of S as stress. So that's the stress response, which should only be activated when you need it. But in menopause, because the autonomic nervous system, is regulated by estradiol. The neurotransmitter of the vagus nerve, acetylcholine, requires estradiol to be properly made and function. So you end up in a situation where you have low vagal tone and high sympathetic. So stress. So when you have the stress, then this part of the stress response is fluid retention, so that if you get injured, like get a big laceration, that you'll retain fluid so you don't go into hypovolemic shock. The arteries start constricting so that, once again, you don't go into shock. And you start retaining sodium, once again, because you want to pull in the fluids. And all of these produce more hypertension, which of course is not a good thing. And because the whole autonomic nervous system is more sympathetic driven, the heart starts pumping faster. So we have that tachycardia, and you are more prone to vasospasm, where the heart, like suddenly the arteries that feed the tiny little vessels in the heart, they constrict. And it turns out that about half or more of women's heart attacks are not the classic, where you have the ruptured plaque and then you get a little blood clot where the rupture, and then it travels downstream, the little broken off like little clot, like a little scab, and then it gets stuck where you have the narrowing, like where you have the thick calcified plaque, and then it gets stuck there. Then you don't have blood flow, and then you go into like ventricular fibrillation. You have a lot of heart muscle dying. That's like the classic heart attack. In women, more than half are not that. It's because of autonomic dysregulation and the small arteries of the heart. We call it the microvasculature. They're not healthy because of all the things that I've just was telling you. And the arteries, they're very little, and they get constricted. And because of the stressor state, because of the autonomic nervous system putting out too much of the epinephrine, the norepinephrine. These are the neurotransmitters of the sympathetic nervous system that create vasoconstriction and tachycardia. And so all it takes is these little vessels to go into spasm, and then you have poor blood flow to some small area of the heart, and that can trigger a fatal arrhythmia. It's not that the heart muscle is dying, that ultimately some would over time. But what happens is this blood flow alteration from the spasming of the arteries, which is an autonomic dysfunction plus vascular dysfunction, leads to a fatal arrhythmia. And it can present differently. It doesn't have that, oh, crushing heart, chest pain, and with the pain going up down the left arm and up into the neck and the chin, and then like so much shortness of breath. That's like the classic presentation of a heart attack, and women can have that too. But many times, at least half or more, it's a different presentation because it's a different creation of this heart attack. And this is so often not recognized. So often what they feel is more like nausea. Because remember, their autonomic nervous system also controls the gut and peristalsis, motility. So they feel like nauseated, or they just, because their sympathetic system is so on overdrive, they have anxiety. And sometimes women go into the ER and they say, I don't know, something just feels really wrong. And I feel nauseated. I don't know what's wrong. And like my heart is beating fast. I feel like kind of like just anxious, like something is wrong. I feel like anxiety. And they to give women like tranquilizers, and they say, oh, you're having a panic attack. And
Mhm.
what they're having is a heart attack, So it's like women's version. So it's really important. And a lot of ER docs, they don't even recognize these things because women do have more panic attacks and they do have more anxiety because they're more oversympathetically driven, which creates anxiety. But sometimes it's not just that, which is bad enough. It's really a heart attack, a special, unique kind of woman's heart attack, which actually has more fatality associated with it than the man's classic
Mhm.
heart attack.
Wow. This is great information, Dr. Gersh. Thank you. Oh my goodness. Well, we are getting close to running out of time, and I want to shift gears again and talk a little bit about brain health
Ah,
with